when people do not have health insurance, even when they're on Medicaid or other forms of assistance, they don't get health care. They don't get health care because they're afraid to go to the doctor. They're afraid of encountering bad news. They know that if they go to the emergency room, they're going to be stuck there all day and they might still not have an outcome, and then they're going to get thousands of dollars billed to them. And so I grew up that way. Still to this day, I didn't have health insurance until I was an adult. I still don't like going to the doctor, even when I know what something is wrong, because I was raised in a home where you just didn't do that unless it was an absolute emergency. And that is how people die, because they don't find out that they have preventable diseases. They don't find out that something is going on with them, and they don't get the care that they need. And so, you know, in New Mexico, we already have a healthcare crisis. We are a state that has about 2/3 of our population that's on Medicaid and Medicare. One of the highest rates of uninsured individuals, although we do have expansion, and we have incredible leadership in our state who have tried to address the healthcare crisis in the last several years. But we also have a problem with basically the business model of keeping our doctors and nurses in state. And so we have like the twofold problem of people can't access healthcare, and we also don't have practitioners. And, you know, Nurse Broth, I wanted to ask you, our nurses have been through so much the last few years, especially with the pandemic and now facing everything we're facing. And then, Doctor, I want to ask you some questions as well. Tell us about what this current crisis means also for nurses and doctors and healthcare professionals, and how it will impact the people who actually provide healthcare to our communities.
I mean, I can honestly say that since COVID, people aren't exactly running to go work in hospitals anymore. Yeah. We saw a mass exodus from bedside nursing care, and younger nurses just aren't really interested in going into a hospital and not being able to deliver excellent quality care to their patients. Then they're coming in and they're lasting a year, and then they're moving on to something that still they can use their nursing degree, but doesn't require them to go in and do a half-assed job, when in reality, all they want to do is go in, and you go into nursing, you go into this profession because you want to take care of people and you want to see them get better because of things that you helped them with. You want to see them not come back to the hospital again. You want to see them thrive, and you want to see them be healthy. And this is destroying nurses and doctors' ability to do that.
Yeah, and I think this is something that folks really, really need to understand. It doesn't matter if you're on the healthcare exchange. It doesn't matter if you're on Medicaid or Medicare or not. This is an everybody problem. Because when they take $1.5 trillion out of the healthcare system between cuts to Medicaid, cuts to Medicare, and the millions of Americans who are going to lose their health insurance, it will decimate the healthcare system, literally. And it's already a mess because of what we've been through. And Doctor, I heard you talk earlier about your time early in your career, and I heard the great introduction, and I was just in your home city a few months ago for the Civil Rights Commemoration in Selma, and I want to close out with that. But you know, you talked about traveling around to rural Alabama and seeing health disparities and health outcomes. And I wonder, you know, you work in a city, but you have this background working in rural health. How do you see the impacts of these policy decisions impacting the communities that you work with?
Well, Heather began with saying about the pandemic. Mm-hmm. And that truly had a negative effect on a lot of physicians and nurses. But lately, like you just said, it's the policy, it's the disrespect. Mm-hmm. It's the lack of belief in science and physicians, and rather believe in something you see on TikTok or the internet. And so a lot of younger physicians are saying, why should we go into this if they're not going to believe us or trust us to give them adequate care? And we can make more money doing other things besides going into the hospital and seeing patients. So we have to reverse that. The trust has to come back to the I had a patient that was telling me he didn't want to do a certain procedure because his brother who finished maybe the third grade was advising him against it. And so when we get this type thing based on people, everybody's a physician now. All you got to do is go on the internet and create yourself. And so we have to get back to trusting people, better conversations with our patients. There has to be a mutual respect between the patients and the physicians in the healthcare community. And then we can do that. And hopefully we can get back to we the people so that the politics in healthcare can be removed. I know right now in Alabama, we have gone from 24 navigators to 4. And as I mentioned before, a lot of our people don't dial up. So they can't go to the exchange online. You have to go and visit them. Yes. So if you've gone from 24 to 4 navigators to cover the entire state, the effects are already happening regardless of what happens with the extension of AXP.
Yeah. And I'll just close out quickly, if it's okay, Madam Chair, with just one quick note, if it's okay.
Okay.
I had the opportunity, as I said, to travel to Birmingham, and I heard this story when Representative Sewell introduced you. And I got to meet Miss Ruby Shuttlesworth, who was the daughter of Reverend Shuttlesworth of the Civil Rights Movement.
Yes.
And hear the stories of the kids who were involved in the Children's Crusade in Birmingham. And the thing that I was struck by, and I want to just leave this moment with, is that in 1963, thousands of young children from Birmingham, Alabama, showed up and protested for civil rights. Children as young as 11, 12, 13, they were arrested. They faced violence. They faced dogs. They faced guns. And if those children could be brave enough to stand up to what they knew was going to happen to them to change the course of this country, we can be brave enough to stand up to Donald Trump and these Republicans. And so I say to you, thank you for being on the front line of this fight.
It was one of my most proudest moments. Thank you.
Thank you.